Welcome to Care's Corner. I'm Carolyn Martinelli. One of the most frustrating things we see is the disconnect between gastroenterologists and either their lack of belief or lack of knowledge about how to best utilize diet and lifestyle for making their patients well. That said, we feel that major changes are on the way for gastroenterology, and we will all be better off for it. Until then, protect yourself by making sure that any gastro you work with knows these three fundamentals. First, the importance of probiotics. A study in the September issue of Clinical Gastroenterology and Hepatology entitled A Gastroenterologist's Guide to Probiotics leaves no stone unturned in providing a roadmap for how gastros need to prescribe or at a minimum support the use of probiotics. Here's why. Nutritional factors, including several B vitamins, vitamin K, folate, and short-chain fatty acids, are produced by probiotic bacteria. Up to 10% of an individual's daily energy needs can be derived from the byproducts of bacterial fermentation. Probiotics help lower stress, balance mood, modulate intestinal immune function, prevent damage to the intestinal wall, and block the effects of pathogenic bacteria. Based upon this study, your gastro should also know one probiotic does not fit all GI illnesses. Probiotic selection should be based upon the clinical indication and individual needs. Continuous consumption throughout the period of desired effect is required for probiotics. Saccharomyces boulardii is a probiotic yeast with the advantage of having resistance to most antibiotics, so should always be taken to minimize antibiotic-induced intestinal damage. Probiotic consumption is safe in most populations, except for critically ill patients receiving nutrients intravenously. Finally, probiotic therapy should always be used for the following GI disorders: pathogen-associated diarrhea, Crohn's disease, irritable bowel syndrome, inflammatory bowel disease, ulcerative colitis, pouchitis, and chronic liver disease. The second fundamental all gastroenterologists should know is the importance of recognizing, removing, replacing, and reintroducing intolerant foods. Progressive gastros acknowledge how strongly food affects the gut, whether it is removing gluten or implementing a program like FODMAPs to remove specific fermented carbohydrates like lactose and fructose. The research proving the benefits of removing trigger foods is undeniable. Working directly with your gastro or having his or her support to work with someone like Bonnie is crucial for an optimal outcome. The third fundamental all gastroenterologists should know is the importance of using reflux medication only as a last resort, as well as recognizing the symptoms of PPI-induced magnesium deficiency. For years, we have spoken to anyone who would listen of the dangers of PPI use. The FDA finally agreed and put a low magnesium warning on all PPI labels if used 3 months or longer. Gastros must recognize symptoms that may include one or more of the following: seizures, dizziness, abnormal or fast heartbeat, jitteriness, tremors, shortness of breath, muscle weakness, spasm of the hands and feet, cramps or muscle aches, or spasm of the voice box. Even if you're taking PPIs for a short period of time, they should be taken every other day with daily magnesium to prevent malabsorption and deficiency symptoms. Finding a gastroenterologist that understands and supports these fundamentals is not easy. So if you find one, hang on to him or her and do not let go. As always, I am at the office on Wednesday and Thursday or by appointment.